So again, my name's Amy Boulanger here with Che Washington. I'm going to give it a merit-based award. It's impromptu. But we, as Margot said, are moving more and more today from information into translating information into action. And we are going to be talking right now about really thinking about things in a different way as one form of action, about looking at cumulative exposures, cumulative effects on our health. Many of you may not know that President Obama actually has awards for national heroes. And if you don't know that, you probably certainly don't know that we actually have one of those heroes in our room today. In recent years, there was a power outage here in the Seattle area that involved a number of folks having to turn to non-traditional heat methods to warm their homes in low-income communities. People were getting sick, and some people even died, and there was a need for quick emergency response to that. And our very own local, Muhammad Ali, provided that kind of response, translating into Somali information, getting it on the ground, and we'd like to give him acknowledgement and award. I hope when we go to the effective action panel that we can count on you to be an active participant in that, Mohammed, as well.
Moving on to the cumulative impacts panel. Great job, Mohammed. Thank you so much for being here. Our panelists can sort of start making their way up to the stage again. Brave the stairs. Thank you so much. Make sure you bring water if you think you might need it. Forgot to warn you about that. You know, we're having this issue with the sun behind us, but I am a true Seattleite. I'm born and raised. I'm not going to complain about it. So I do apologize it's sunny. I don't really. Thank you. I'm never going to apologize. So I'm going to turn it back to Elise, who's agreed to moderate the second panel on cumulative impacts. And I'm really looking forward to this because some questions that you guys were already thinking of about, okay, well, it's not just chemicals that we're exposed to. It's just living in this world, and we have a lot of other stressors. So again, pay attention to that notes for effective action and jot down what you're hearing about what resonates with you and start to think about, I don't work in the environmental field, or I don't work in the environmental health field, but I'm here because I know that there's a connection to the work I do. And we're going to talk about those different types of these connections in this panel. So, Elise?
Thank you. Is this working? It seems to be. So welcome back for the next segment. We've been touching on the cumulative impacts piece and by looking at these various factors, and this will be deepening our conversation about how these factors such as nutrition, poverty, chemical exposure, and so forth interact and influence our health, really starting at conception. So I will not reintroduce Ted Shetler, but I will say that Ted has just published his latest book called The Ecology of Breast Cancer. And this is really using breast cancer as a case study and looking at an ecological or systems-based approach to health. And Ted can say much more about it, and he will be saying more about it on Che's call on December 16th. Michael Lerner, who is president of Commonweal and also co-founder of Che, will be interviewing and having a conversation with Ted on that call on December 16th, and you can find that on our website. And I really appreciate the research that went into this book to begin to tease out all these different factors and using the endpoint of breast cancer, but it could have been many other health endpoints. So thank you for working on that. And so we also have Kim Hurley, who I did introduce earlier, and so I won't do that again. And down here at the very end, Peggy Shepard, whom I've known for a number of years and had the distinct privilege of working on different projects. And Peggy is a co-founder and executive director of We Act for Environmental Justice, which is based in West Harlem. And it just celebrated its 25th anniversary. And Peggy is really, I would say, a national hero, national leader certainly on environmental justice issues. She's been working to engage some of the North Manhattan residents around environmental concerns, how to protect themselves and how to act on policy. And she's also partnered significantly, extensively with the Columbia Center for Children's Environmental Health, headed by Frederica Pereira. I think Susan Buchanan mentioned one of her studies there where the women wearing the air monitors, they were based in the neighborhoods where Peggy has been very focused. And so it's an incredibly community-based research project where some of the seminal results have made some real changes, such as getting chlorpyrifos out of the our products, and so that it's actually reduced what the head circumference was and birth weight, and actually by getting chlorpyrifos banned in Manhattan, they were able to see the result that these the head circumference and birth weight were increased again, or to normal, which is just incredible. So Peggy's also served on the EPA's National Environmental Justice Advisory Committee, and a number of different roles that I could mention. So I'm just delighted to have Peggy here from New York. And I am also really pleased, you didn't have to come quite as far, fortunately, but this is Emma Medicine White Crow, and I have admired your work from afar. I've heard you speak, at least on one occasion, but I've not had a chance to meet you, so I'm really pleased to have you here.
Pay you later.
Okay. So Emma is chair of the Washington State Governor's Interagency Coordinating Council on Health Disparities. She's also a member of the Region 10 Health and Human Services Regional Health Disparities Council, and is currently working with the Port Gamble Sklallam tribe on health reform and the Affordable Care Act implementation. And she serves on the executive committee of the Equal Start Community Coalition, Seattle-King County Race and Justice Committee, and is a member of the Race and Equity Core Group at the National Network of Grant Makers and multiple other philanthropic organizations. So she's just doing work in many, many different sectors on these issues. So we're very grateful to have you here.
That just means I volunteer a lot.
Yeah, right. Well, thank you. So we will start again with Ted providing an overview of cumulative impacts for about 10 minutes.
Thank you very much. I'm just going to take a few minutes to sort of lay out a framework that hopefully will help a little bit in the subsequent discussion. I think everybody in this room sort of comes here with this framework, but I just want to make it quite explicit that individual people actually live in families and communities and societies and ecosystems. And there's a lot of interaction that cuts across those levels. I mean, people in public health sort of grow up with this idea. It's not made its way into clinical medicine as rapidly as many of us know, that there actually are impacts of the communities we live in that we ought to be paying attention to in the clinic as well. But this is really fundamental public health. And that we should think about the interactions across those various levels, both to understand impacts, but also to begin to identify opportunities for intervention. And once again, the whole idea of the time dimension, I think, enters into the cumulative impact discussion. We've talked a lot this morning about the importance of the timing of exposures during development and what their impacts can be. And I think we also want to then keep in mind the effects of multi-level variables over the lifespan as we think about this. And also remember that the world we're living in now is largely constructed by us in many ways. And that's in recent historical time. But if we compare that to the evolutionary time in which humans developed, is quite different. And so we begin to see the system conditions that we've created that involve lots of variables that come together to either create the sort of the context that generates resilience and the capacity to sort of withstand perturbations that might otherwise lead to adverse outcomes, or alternatively, that create the conditions of vulnerability, where small changes can actually tip someone over the edge, over a threshold, tip a family over the threshold, tip a community over the threshold, from which it's hard to return to other more healthy operating conditions. So that's sort of a framework to begin with. And we can talk about both cumulative exposures, some of which have already come up today. It's not multiple chemicals, the nutritional environment, the social environment and so forth. But we also can talk about cumulative effects, and I hope that will come out in this discussion as well. That often what we see in communities and in individuals that are exposed to multiple multiple exposures that can have adverse consequences, we just don't see a single outcome, but we actually see a constellation of outcomes where there's a lot of comorbidity. We see communities where diabetes, obesity, cancer, depression, and so on are common in the community because of the multiple stressors that are leading to these multiple health outcomes. So what that begins to tell us is that if we are smart and strategic about where and how we intervene, we can actually have multiple beneficial downstream effects if we choose our interventions wisely. So it actually has very sort of practical consequences. I want to give just two examples to maybe help stimulate some thought and conversation about that illustrate a couple of these points. This is one that actually comes from the Columbia Center for Children's Environmental Health, where Peggy has done work. This is work with a large cohort of 226 mother-infant pairs that have been followed over a period of time. Again, much like the study that Kim talked about, where they were identified, established in the cohort during pregnancy, and then the children have been followed as they grow up. And this is just one piece of data that come from this very large study, where the scientists were interested in what the impact of exposure to environmental tobacco smoke might be on the neurological development of children as they grew up. Now, none of these mothers were active smokers, but some of them lived in an environment, in a house or a building where people did smoke. And so what they were able to do was actually measure the cotinine, which is the nicotine residue in the urine, to get a quantitative estimate of what the exposure to environmental tobacco smoke was, and then to see what impact that had on children's neurological function at age 2, using an age-appropriate measure of neurological function, the Bayley scale. But what they also did was look to see whether that effect of the environmental tobacco smoke was modified by what was described as maternal hardships. And maternal hardships were whether mom at the perinatal area experienced either lack of food, shelter, or clothing at some point during that perinatal time, and whether mom experienced more than one of those. So here on the bottom, and for those of you who can't see it over here and down there, what we see here is a graph showing the number of maternal hardships plotted against the Bayley scales of mental development for the children as relates to environmental tobacco smoke. And what you see here is that the children who were not exposed to environmental tobacco smoke at any significant level is the upper line. The maternal hardships during the perinatal period had very little effect on the neurological development of the children. But in the children who were exposed to environmental tobacco smoke at higher levels during the perinatal period, when you piled on top of that maternal hardships, it really had a significant impact on the neurological development of the children. So that when mom had 2 or more of the maternal hardships, environmental tobacco smoke made a lot of difference in terms of the mental development of the child. So we need to think about those together. The next example has to do with premature birth. And I use this example because premature birth is a big deal. It's a big public health problem, and it's been virtually intractable. We still don't quite understand why so much preterm birth happens. And my view is, after looking at this for a long time, is that this really is the result of system conditions. There are a lot of things that contribute to it. And we need to begin, I think, to think about it as a more systemic problem as opposed to identifying just the single variable that might be contributing to this. And the reason I think it's a big deal from a public health perspective is because it has a lot of consequences. Children who are born prematurely are at risk for a number of illnesses, not only childhood mortality, but also infant illnesses, and effects on neurological development and so on that actually they carry with them throughout their lives. So it has huge public health consequences as large as economic consequences. So this is one study that attempted to look at the relationship between preterm birth and exposure to traffic-related air pollution. And looked at that relationship as it was modified by socioeconomic status at the community level, not at the individual level, but at the community level. So it was done in Southern California. It was noticed that in the winter there's more air pollution and it tends to settle with the colder air, and so the levels at ground level are higher during this season, and that's true whether you're in a high-income community or a low-income community. A low-income community was defined as having greater than 10% unemployment, more than 20% of families living in poverty, and more than 15% receiving public assistance. And then you can see here a high socioeconomic status community was defined as less than 10% employment, and so on. So these are community-level markers. And what the study found was that in the lower socioeconomic status community, now again, this is a community-level variable, it's not individuals, that in the lower SES community, higher traffic-related air pollution had a 30% increased risk of preterm delivery compared to those who lived in less trafficked places. In the middle income or middle SES communities, it was only an 18 to 20% increase in preterm birth, and in the higher SES communities, traffic-related air pollution had no effect on preterm risk. So next slide. What the authors of this concluded that was reducing preterm birth warrants a concerted effort of social, economic, and environmental policies focused not only on individual risk factors, but also the reduction of localized air pollution, expansion of healthcare coverage, and improvement of neighborhood resources. So you begin to see how the interventions that are being proposed cut across not only individual level variables, but how are we going to improve the community at large. And I'll just sort of end up here by pointing out that lower socioeconomic status is associated with an increased risk of many diseases and disorders. So you begin to see how if we addressed this, we could have multiple beneficial downstream effects. But short of doing that, we can also see what kinds of challenges we're running up against. And this is probably due to combinations of increased exposures to hazards, increased susceptibility, that is, increased biologic susceptibility, as well as decreased capacity to cope and recover. And there are many biologic markers, as we previously mentioned, that we can actually use to measure the biologic impacts of lower socioeconomic status, how it actually influences biology. So we end up with pregnancy sort of outcomes looking a little bit like this, with all of these things, racism, stress, social support, toxic chemicals, infections, nutrition, all sort of tangled up together. This kind of model is pretty common for people to put together, and it's easy to look at something like this and throw your hands up and say, so what am I supposed to do about that? And I just want to end by saying that there actually are some reasons to do this. For one reason is it helps us acknowledge and communicate the complexity, that we're really dealing with a systemic problem, that this is not something we're going to solve with a single technological intervention, but we have to think about changing the system conditions. It highlights the need for broad and diversified efforts to study and change the dynamics of that complex system. It also helps us to make sense of the complexity. And once we begin to sort of see that general architecture, we can begin to identify some of those places to intervene in the system that'll build resilience into it and try to decrease the vulnerability. Not with a single intervention, but thinking how in all of our work individually we can collaborate across the work we do to begin to influence that system in favorable ways. And it will help us develop those strategies, looking for those leverage points, looking for the feedback loops that we want to emphasize, getting rid of those feedback loops that are actually detrimental, that are helping the whole system wind down into more and more vulnerability. How do we reverse those feedback loops? Look for those causal cascades and try to intervene upstream. This is sort of public health kind of language as well, but I think that those are the ways that we begin to influence the operating conditions of that system. And I think that's all I have. So I'll stop
Great.
there.
Thank you,
Great.
Ted. Let Ted get seated here. Since the last panel discussion was about science, I wanted to kind of start with, with Kim, put her on the spot, and talk about, given the challenges, we looked at that graph there with all the different arrows going everywhere, and how in research can we begin to, I think she has a mic, can address, because it's a much, where you can focus on one chemical, it seems, it's a lot simpler. So how is this changing the research and thinking?
Actually, when I saw that web, the complex web, I looked at it and I thought, wow, I have a really hard job. I hope you guys appreciated that. That's the kind of thing that we deal with all the time. It's one of the things that we really struggle with, especially in human studies, because we know that no person is living in a vacuum. I mean, we have so many things to consider. So you have to consider the individual genetic makeup, because we know that some people are more susceptible to certain chemicals than others just based on their genetics. That's actually something that we've studied in our farm workers. We know that there's a specific enzyme that detoxifies organophosphate pesticides, and some people have very low levels of this enzyme, making them more susceptible, and some people have high levels, meaning that they can just, get rid of the chemical from their body much faster. So that's one of the things, one of the interactions we're looking at is, okay, given that you're exposed to this pesticide, now can we look and see if people that have this genetic disposition, if we see stronger effects. And in fact, that's one of the things that we're starting to see, is that people that have low levels of this particular enzyme, the moms with lower levels of these enzymes, their children we're seeing stronger effects in their children. So that's one example of an overlap to look at. But then, of course, there's the community overlap. And we know, Ted presented a few studies, and there's other studies too that show that we know that living in a stressful environment, or living in a violent community, or racism, or all these sort of aspects of stress, we know that impacts your health. And we know that there are chemicals that impact our health. But now what we're starting to see is that when you have those two things together, the effect of that chemical on your health may be magnified if you have other stressors. And that's really important from an environmental justice point of view, because we know that low-income communities tend to be the more polluted communities. And so you're getting compounding of factors. So that's another thing that we've tried to look at. And lots of scientists have tried to look at that. But then one of the big issues that's very difficult to look at is, of course, we're not exposed to one chemical. We're really living in a chemical soup. And we need to think about how those different chemicals are interacting. It doesn't make sense to look at it just one at a time, because they may be synergistically having effects. And I think we're all very aware of that. There's a big push at the federal level from NIH and from EPA that we need to be taking these mixtures of chemicals into account. From a scientific point of view, it's really hard. And we're all struggling with it. Not to get too statistical on you, but you can imagine that, if I'm comparing people with a high level of pesticides to those with low levels of pesticides, but now I want to see if flame retardants play a role. So now I have to divide my people into high pesticides, low pesticides, high flame retardants, low flame retardants. So I'm already cutting my group in 4. And then I start putting in more chemicals. Well, I have 600 women. When I start dividing them into high compared to low, I don't have enough women to even have statistical power to look at anything. So really, when you want to start comparing multiple chemicals piling on top of each other, we're talking thousands of people, or 100,000 people, to really start teasing apart all these interconnections and these webs. And it's as we're entering, you hear people talking about big data. That's starting to be what we need. We need these really large-scale kind of national studies if we really want to start answering these complicated mixture questions. And we need to. They're really important.
So, well, Peggy, since you're the work you've been doing with Columbia in West Harlem and the community-based research there, you've been referred to several times, but since you're here, maybe you could elaborate a little bit more on it and how, again, some of these different threads of exposures and stressors and so forth feed into that research.
Yeah, so I work in a community in Harlem, Washington Heights, East Harlem, Central Harlem. That's an environmental justice community impacted by a myriad, diverse kinds of pollutants. We house over 1/3 of the city's diesel bus fleet, which is the largest in the country. A number of highways and bridges intersect in our communities, and we have sewage treatment plants and all kinds of other kinds of facilities. So when we really wanted to find out what was going on in terms of health outcomes, we reached out to the Columbia School of Public Health to begin to work with them. We started with some pilot studies to look at the impact of air pollution on children going to school in the community, and finding out that in one school that was actually the control school in a very less traveled street, that 75% of the junior high school kids had reduced lung function. So just living in in the community meant that kids were impacted even though they weren't going to school on a heavily trafficked street. And over the years, we began to work with the Columbia Children's Environmental Health Center. We're a community partner there, and we work to translate the research into policy and educational initiatives, and eventually into interventions as well. And so looking at the cumulative impacts, certainly cumulative impacts have been a foundational concept of the environmental justice movement in this country, because we understand that we are exposed to a diversity of pollutants from a number of sources. And we have been working with the EPA over the years to figure out a way to begin to measure those cumulative impacts. And it seems as though the EPA is now beginning to fund some studies that are doing just that. So at the Columbia Children's Center, we have looked at the impact of tobacco smoke with other pollutants as well as pesticides. You mentioned chlorpyrifos and diazinon. It was really interesting because when the study first started, chlorpyrifos and diazinon were both chemicals that were used in household pesticides. You know, we use a lot of pesticides in New York City to get rid of roaches, mice, other kinds of pests. And of course, those have the unintended consequences of impacting kids with respiratory problems. But during the study, the EPA finally banned both of those chemicals for residential use, not for farm worker use, unfortunately, but for residential use. And so over the years, we were able to see the decline of those chemicals in cord blood of the children. So we know that that regulation really does work. Lately, I've been working with the University of Pittsburgh on an EPA STAR-funded project to look at the impact of psychosocial stressors and air pollution on asthma outcomes. And so we have just finished doing about 3 focus groups per borough, 5 boroughs in New York City. 2 of those were adults. 1 was all Spanish language. 1 was all youth. And so we wanted to understand the variability of stressors across the city. But what we really found was that the stressors that were identified by community residents were fairly similar. And so there were about 8 or 16 of them, and we sort of developed them into domains. And those were physical disorder and neglect, thinking about parks, open space, sanitation, police and safety. You know, you've heard stop and frisk has been a really big issue. Gentrification and racism was a very, very important theme throughout all of the groups, because so many communities in New York City are being gentrified, and people who have been living in those neighborhoods are fearful that they will be pushed out or that they will no longer be able to afford to live in those communities. So that is a very significant stress along with racism. And then for the youth, the school environment was an important stressor, whether it was tests or bullying or other kinds of incidents that might happen in school. So those were very important. And when we start thinking about livability, I don't want to get too far afield here, but when we start thinking about livability, a lot of studies are being developed to develop indices of what makes a livable community, and looking at those indices that really contribute to health disparities or reducing inequities. And so again, developing those kind of indicators that really determine what is a healthy neighborhood or community is what really is that context for the kind of work that we're now talking about. It's the context for those environmental exposures and those cumulative impacts. So we have been able to take a lot of the data. So the air quality data, for instance, the impact of PAHs in diesel, which we found were creating low birth weight, developmental delays in almost 30% of the children. That means it's going to be hard for a kid to learn in school. There have even been some IQ points that have been lost as well. And so we have been able to take that data, and after 18 years, have gotten the Metropolitan Transit Authority to invest in total clean diesel retrofits, and they started using ultra-low sulfur fuel before the EPA phase-in. BPA and endocrine disruptors, which have been newer results in the last few years, was a little easier, actually. After about 1.5 years, we were able at the state level to get state legislation banning BPA in children's products under the age of 3. You know, I don't know why we have to segment everything, but that's what we were able to get. And also, we were able to ban chlorinated tris, one of the flame retardants. And again, being able to use data that is neighborhood specific in New York City, to go to the city council, to talk to our elected officials with data on women who are living in the Bronx and Harlem has been very powerful. And even at the federal level, the Toxic Substance Control Act, which everybody's been working to reform, we were able to take a stroller brigade to Washington, and we had one of the largest busloads of folks going there to talk to their electeds about these issues. So community education to inform folks so that they can go to their elected official and tell them their stories, because residents have their own stories around these issues. They're very powerful. Using video to video those stories, using photo voice. Another method to communicate that story to policymakers is very, very important. And the role of translating that research, having community partners at centers that are strong advocates and also are on the ground in their neighborhoods with community residents is just very powerful and very important.
Peggy, extraordinary work, and I want to build on that. Emma, with your work on health disparities in this region, I'm wondering what kind of parallels you see and what areas of priorities you're concerned with here.
Well, first and foremost, thank you very much for having me here. I'm kind of humbled by all the researchers in the room. That's past life for me. I'm an organic chemist, so I feel fully fulfilled in order to put on some hip waders and go down to Olympia and work with legislators. So in that context, what I see happening is the work that's being done in community is of the utmost importance. It's more than just education, because from my perspective, they're the key partners. I work with 14 state agencies around the table at the Interagency Council, and we're the Washington State Office of Minority Health, but we don't disperse any funding. What we do look at are things and legislative pieces that will either undo harm or perpetuate harm to communities of color. But our work is race, it's gender, and it's also one of our key priorities as mandated by law. Women. So in that context, my voice is very small. It's much better for me to have a member of the community not only come before the council, but come before legislators. without them, I get no traction. I get no advocacy. They won't listen to what I have to say. We every year we create a review on policy of what our priorities are going to be, our state action plan. And it's a great shelf holder. I just handed a copy to our new governor, and he read it and said, this is wonderful. I have another one that was a little bit more florid and deeper work that he wants to focus on, but what I told him was, look at what we've already accumulated and what work has already been accomplished, and partner with us and realize that where our voice is back in community. We will help you build whatever effort you're trying to fulfill. And in these economic times, if we don't work together, our work is going to be harder. And I'm very honored and blessed to be connected to so many researchers, because I can't do what I do without your information. If I don't have that, the data, if I don't have the consequences, I don't have as big of an impact, because again, it's that fact, the truth. I may know what has happened to me personally. I may know what has happened to my community. I may know what the impact is in my state or region. But if I don't have the facts, that scientific perspective, most of the time it's ignored. It's taken as anecdotal. And my pushback is to use both. Use both the anecdotal, use what is the priority for community, with the fact of the researchers, with your support, in order to undo the harm that's been done. My life work is doing as much as I can to undo the harm, not only to my community, but every resident in Washington state. I can't do it by myself. That's an impossibility. So my charge is, okay, I can help you, but you have to tell me what you need from me in order for us to get the work done together. So that's what I see happening. I'm very lucky now to have, again, because of the economy, what we lost was a real key component for us. We used to do health impact reviews for legislators as they looked at the laws that were coming up. And that was mandated by our law, but we lost that staff support. We lost a person. Now we've got one back. And I'm so happy to have someone there that can go out and find the research that's been done and hand that to legislators as they review what that impact is going to be on community. And I have a very open hand. I will work with anyone. But my charge again is making a difference, making things better. I was talking to my table mates as I was absorbing the wonderful information being presented. I said, oh, geez, now it's epigenetic. Now something else I have to worry about. I'm a diabetic, I have asthma, okay, I'm a beast, I'll admit to it. I'm also American Indian. And how many Indians are there American Indians are there in the room? One. And myself. In Washington State, we're 1.6, sometimes 1.2 of the total population. Infant mortality rates in King County for us are at, Maria, correct me if I'm wrong, 14%? Right. But we're a small portion of the population already. So it's more than just education, and it's more than just looking at smoking rates. Again, we have cigarettes and we sell them in every tribe that I work in, and I'm an asthmatic, and that's one of my triggers, so I have an issue with it, but that's me. We need to educate the youth to not smoke. They're cheap on any reservation. How do you send that messaging out there? And I'm working on a breastfeeding grant. How can I explain to a mom, please breastfeed your infant? Because you know what? They still remember the stories from grandma. Don't breastfeed. Don't bond with that child. That child's going to be taken away. Don't breastfeed. It's a terrible message and a terrible memory. That's the battle. And I'm also listening to the impact on the environment in big cities. Don't forget the rural communities. Some of the worst Superfund sites are on reservations. So that's what I'm looking at. And as far as legislative power, I have none without the voice of community. And right now, it's at the best opportunity you have is to get on a bus if we're having any action that's coming before our legislators and you feel that's your passion, you want to make a difference, no more coal mining trains in my community, come on down. Speak up. We need you.
Thank you. And can you just give an example of where the work you've been doing with these communities, where there has been a positive impact, where an intervention is taking place in terms of health disparities?
Positive impact, multiple positive impacts as far as changing the nutrition, messaging that happens out there, environmental exposures. Tribes are actually cutting back. You know, most communities and rural communities, we burn wood for heat. But now we're looking at that impact to the environment, and guess what? We don't have as many trees to chop down. So we have to look at alternatives. We're looking at the hazards of the different impacts of molds and free housing. Free housing sometimes isn't free. We get our housing from the federal government. Sometimes they're modular homes that are more appropriate for the Southwest because that wonderful black mold will grow in them and we didn't know it. So it is successes that I've seen. We have the coalition in King, Kitsap, and Thurston County, which is the Equal Start Coalition. We're looking at infant mortality rates and how to work together and how to ensure that we can bring those rates down, not just in the American Indian community, but also the African American community. And what I have found and what research will prove is that the longer you're in my country, and by the way, welcome everyone, the more your statistics will look like mine the longer you're here. So pay attention. And that's the only voice of reason that I've heard. That quote was from Michael Bird. He's a Pueblo Indian, and anytime he does a conference, he always says, okay, who's Indian? Well, there's nobody here, but it's just me, so welcome. I'm checking passports. But anyway, and thank you to the Duwamish tribe for allowing us to come together in this forum, in this meeting. This is their land, and I never forget that every step that I take, my people were here.
A lot of food for thought. Well, Ted, in your presentation with the complex diagram you were showing, you also alluded to places, you know, we can't just throw up our hands, obviously, and it's clear that the people who are not throwing up their hands but are doing the work, or the rubber hits the road. But what are some of those places, intervention areas that you've seen where we could prioritize? And they could be small examples or sort of broader ones.
I think in childhood health, one that stands out is early childhood education as being an important leverage point, that there are multiple downstream benefits that have been demonstrated over and over again. And it's always disturbing when we see early childhood education being one of the first things that is sacrificed when there are economic or political changes. But I also want to, because of the nature of this conference, just reflect for a moment. I hadn't thought about this until just now, but the Centers for Disease Control published one of their weekly morbidity and mortality reports, I don't know, maybe 10 years ago, pointing out that pregnancy outcomes in Madison, Wisconsin were distinctly better than pregnancy outcomes in Milwaukee, Wisconsin. Looking at infant mortality or various measures of morbidity in infants born in those two cities. And they wondered why. Because it couldn't be that there was a difference in availability of Medicaid, for example, because they're in the same state. People in both communities had access to the same Medicaid. There certainly were providers, healthcare providers in both cities. And so they began wondering why there was this really dramatic difference. And there was never a single answer, but the conclusion that was generally reached was that young families, young women in Madison had access to more social support and community level support than young women in Milwaukee. And when I've talked to people from Wisconsin about this, many just immediately go right to racism and say that there's a context of racism in Milwaukee that does not exist in Madison. Madison, as you know, I mean, it's a large university setting. There, University of Wisconsin and Milwaukee as well, but it's not nearly as big. Madison and Milwaukee are just distinctly different places. I mean, there's a lot of industry in the history of Milwaukee that's not present in Madison and so on. What always struck me about that was that the take-home message to me was that if you built in this resilience, beginning with young girls and young men, and boys and girls in the community, and began to think about I mean, I always hesitate to talk about our children as being future parents, as if that's their role in the world, but many do become parents. And if we begin to think about the opportunities of building healthy parentage in early and often in children, I think we're just going to build a more resilient system that will end up at having healthier. Now, that isn't to say that the work that Kim and others are doing isn't important, because yes, we want to look at the pesticides, and we want to look at the tobacco smoke, and we want to look at all the other things as well. But I think our challenge, and what I sort of feel is happening, is that people who are doing this really important science that's looking at individual variables, we're beginning to look about how to integrate that back into the system analysis. So that it's not that one is more important than the other, but our challenge is to reintegrate them so we can continue to do the more reductionist work, but also think about how we bring that into a more integrated public policy.
Thank you. One other topic that's come up a couple times are people refer to the Toxic Substance Control Act, which was passed in 1976 and basically grandfathered in 65,000 chemicals and basically has not been reformed since that time. So there's a number of people working on that issue. And Peggy, I know you've worked quite a bit on that, and Ted, you're well aware. Kim and others, I don't know if you're more in the research realm, but maybe say a few words about that, because it's come up, and as you say, some of the most effective work can be at that level.
Well, right now the most effective work isn't in Congress, unfortunately. Actually, there's more opportunities at the city and state levels, but there has been a national coalition for many years, probably 8 or 9 years, Safer Chemicals, Healthy Families, that's been working with networks and groups all over the country, and now they're focused on a bill in Congress that was proposed, or that's been, I guess, what's the word? It's come out of committee, so it's being debated now. And unfortunately, the chemical industry has really been lobbying very successfully to make sure that key elements of the plan don't happen. So Barbara Boxer, who's out here in California, has been very oppositional to the bill, because the bill would actually take precedent over stronger state rules. And so California has some stronger regulations against chemicals than other states, and this new congressional bill would, overtake those and render that law null and void. So Barbara Boxer has been a chief opponent of this bill. There's some other issues around hotspots that the environmental justice community has been asking for, looking at particular vulnerable communities, and none of those components are getting any traction. And some of the major environmental groups are supporting stronger standards. Others feel that any bill is better than none. So right now there have been hearings and there's a lot of activity. I'm not sure that it's going anywhere and that we're really going to come out with a real overhaul of that bill that really is protective of children and families.
Well, I think this afternoon we'll probably get more into what's happening here in this state with some of our local champions working on policy issues. And so I just, we can kind of wrap up here because I know people have lots of, questions out there, and it might actually be interesting to really kind of bring those into our conversation at this point, unless there's anything else that people want to highlight right now. Is there another?
I think I wanted to touch a little bit on something that Ted mentioned about early childhood education. We have a really difficult job. One of the things that we do in our study, we have a community in Salinas, in an agricultural community, and we're a community-based participatory research project. And what that means is that we went to the community because they were concerned about pesticides, and it's really important to us that they be the first one that knows the results of our study. So actually, it's on my mind because this weekend is our annual community forum where we go down and we say, what we found this year. And also this year we have a bunch of we have individual results to return, so the people that are in our study can come and find out what their levels of certain chemicals were. This is a digression, but I'll say that it took us about 2 or 3 years to get permission from our university IRB to return those to the community because there's a lot of people that feel like that's ethically unresponsible, or there's a lot of ethical issues, and we felt like that was something that we owed the people that are participating in our study. But one of the things that we do is, in the past, we've had to go down there and say, we have found that the exposure to pesticides in this community is lowering the IQ of the children in this community. And that's a really hard message to deliver, especially since it's exposure that's already happened. It happened during pregnancy. And we've struggled with, what do we say? What kind of good news can we give them? And one thing that we have struck upon is the idea of enrichment in early childhood, reading to your children. If you can't read, you sing to your children. The different ways that you can provide that enrichment in the home can help ameliorate some of the effects, we hope, of the environmental effects. And this goes back even to the animal literature. There are studies that show that rats that were exposed with lead early, prenatally, if those rats were put in a cage with a wheel and with toys and with friends, with social interactions with other rats, they have the effect of the lead on their learning is sometimes even not even there, but certainly better than the rats that were raised in a non-enriched environment. So that's one of the things that I feel like is really an important message to give to communities. Of course, we need to work at lowering these exposures in the communities. We also need to try and help find other ways or give people things that they can do. And I think early childhood education is one of those really important areas.
Thank you, Kim. That's great. So, Margot, are you going to?
Thank you so much. I have got a lot out of that conversation, and talking Ted, your slide in particular about focusing on prematurity. As a mom of a 26-weeker, I'm sure I'm not alone in this room having a premature baby. Thinking about the economic impacts of that, that hospital stay alone, not to mention the impacts later in life, was over $1 million for 107 days in the hospital. And you magnify that by this problem that we have in our society with prematurity. And it's super important, not just for me as a mom, but as a society to really address. So thank you for bringing that up and for all of the work that you guys did. I'd like to give you guys some time now, just like we did after the first panel, to reflect at your table. You've been so good at following directions, really. I'm going to give some more prizes for sure. So I want to give you about a minute to look at your handouts. You've got a couple in there, and you you guys stay put because we're coming back for questions because I know you have a few. You've got another handout in there that it's called the script for effective action. And what I want you to start thinking about is, for me at least, I was hearing and thinking about ways that I can look outside of my field of environmental health and think about integrating this work into my work. And so I want you to start thinking about in what ways you, as a person from public health or a person in community services or a person from some sort of NGO or from the environmental field, can start integrating some of these other stressors that we talked about in this panel. Let's hear some of these questions that are coming out from the table, or starting to think about potential actions that you want to take in your work. Please, and introduce yourself.
Hello, everyone. I'm Lorelei Walker with the Institute for Public Health Genetics at UW, and we're talking a lot about multiple exposures in the house and starting to go into measuring that and what to do, go in to advise people. And I'm wondering what your opinions are on whether or not everybody should have a filter on their tap, and whether or not low-income housing should have regulation by public health to have filtration on their tap water. As I think about epigenetic toxicity and multiple exposures and the research that I do, I just don't understand why that's not a public health message, or if maybe that's just that question is not valid.
Jump in on that?
Well, I think, you know what? If the panel has a comment, if anyone else has a comment on that, feel free. Did Peggy, you want to address that?
Well, I think that really depends on the locality, because some municipalities have great water, and there's no need to have a filter on the tap. A lot of the problems with water is the pipes in that particular building, and there are a lot of really badly maintained buildings or older ones, and so even in places with great water, you'll have brown water coming out of the tap because of the pipes in that particular building. But I'm not sure that there's a need to have a national regulation about that. I really think it's a more local kind of issue.
Yeah, the other thing I would add to that is that there's no one size fits all, because the way you address contaminated water differs depending on what the contaminant is. And so some filters work for one thing and you need another technology for another thing. But the final point is that, at least a final thought is that in some ways it gives us an excuse for having contaminated water as the norm if we're addressing it with a technological fix at the end of the faucet. And I'm bringing this up now because around the world, water is becoming increasingly scarce, and safe drinking water is becoming increasingly scarce. And what we're seeing is a push by private corporations to privatize the water supply all over the world. And what we're going to end up with, I'm concerned about, is once again people who have the means to have access to clean drinking water have it, while people who don't have the means won't have it. And I think we need to think about drinking water as being a right, and to the extent that it's contaminated, it ought to be cleaned up, and those responsible for it ought to clean it up. And that's not to say that we shouldn't address the contamination that's coming into our houses now, but I don't think we should see that as a public health fix.
Follow up on the water issue.
It's Eileen Gagney with the Lung Association. So I really appreciate what you're saying about a global thing. Yes, water is our most precious resource, and there's a lot of waste that goes on. But I think in substandard housing, it also depends on the age of the structure. So houses built before '78 could have lead in the solder. So like what we do is we do healthy home assessments, and one of the things we do for folks is say, if that is an issue for you, run your tap water for 30 seconds before you use it, especially first thing in the morning. But you're right, there's lots of different contaminants.
Eileen, since you're talking, can I just get you to mention the program that you have for City of Seattle residents?
Thank you. So I am the director of the Master Home Environmentalist Program. So we have volunteers and staff that provide healthy home assessments for anybody who lives in Seattle, King County, and it's free. and we give green cleaning kits, we give high-quality walk-off mats, and if the families have children with asthma, we give dust mite pillow covers, mattress covers, and a HEPA vacuum, limited to the first 20, okay?
So who doesn't like free? I can't think of anyone. That is a fabulous resource.
So what we
Eileen.
do is we actually work with the resident to come up with 3 things that they can do, because there are so many issues. I know the dangers of carpeting. I can't afford to change out my carpet, right? So we work with them to come up with things that they can do, that they're willing to do, that can make a huge difference. Like, what's the best thing you can do in your home besides not smoking? Take your shoes off. Everybody can do that, but it's a huge behavior change. Anyway, thank you, Margot.
Thanks, Eileen. Yeah. That program which, Eileen is referring to is through the American Lung Association. It's called the Master Home Environmentalist. I believe you guys have a table in the exhibit hall, so at lunch and you want some more information about that, please feel free to pick up. So I want to get to another question over here. Question, comment? Great idea.
Hi, my name is Audrey Adams with Washington Action for Safe Water, and glad this topic was brought up about water because I feel extremely strong about one of the problems that we have with the whole, well, let's filter the water, is that means that those of means can filter and those without means cannot. And why are we having to filter our water? In my household, the reason I have to filter the water is because we add fluoride to it. And there's 2 of us who are highly sensitive to the fluoride that's in the water. We are not practicing the precautionary principle. And I can tell you that almost everything you've talked about today relates to the issue of fluoride. Fluoride's a drug. But we're giving it a free pass. It doesn't deserve a free pass. It hasn't earned a free pass. We haven't done the studies on fluoride. And, well, we haven't, but many places around the world have. And in fact, 2012 was a really important year in that Harvard School of Public Health did a study, and they took the 27 strongest, best, highest quality studies on neurodevelopment and fluoride from around the world, and they found that 26 out of 27 studies showed there is harm to the developing brain. Why isn't there a huge outcry about this? There was a study also done last year in Ireland where they looked at fluoridated Southern Ireland, which is the Republic of Ireland, versus Northern Ireland, and they looked at all sorts of disease states. What they found was 55% increase in autism, 83% increase in Down syndrome, which refers a lot to the issues that you had with how it can affect multi-generational. The most concerning number and there's many, many different disease and mortalities that were studied in that. It's fascinating. It's done by Declan Waugh in Ireland. Was a 300% increase in sudden infant death syndrome between the fluoridated region in the Republic of Ireland versus the unfluoridated Northern Ireland. No more free passes, please.
Obviously, it's a very interesting topic, and we don't have all of the answers. We don't claim to have all of the answers. We do have a panel at the end of the day that's going to be addressing some of these, these topics that are concerning, that the science is still out. Of course, we all have the same goals in mind, and that's to protect public health. And so I just wanted to get a couple of the other questions and comments out from other tables. So I'm going to keep raising those hands, and we will come find you. And don't let me forget to give away the prizes.
Thanks, Margaret. Margaret Schill with the Local Hazardous Waste Management Program. Thanks to all of you and the work that you do, and I'm just got a sunbeam in my eye. So my question with cumulative effects is, how do we work more effectively to come up with the interdisciplinary solutions to these cumulative effects. So we tend to have water agencies and air agencies, and we have smoking cessation units, and then we have early learning people, and we have the folks focusing on toxic chemicals and consumer products, and then we have the people focusing on where we build our roads and where we put our bus stops. And that's where the funding goes. So can you talk about ways that groups have worked successfully across those silos and what else we can do to be more successful?
That sounds like a pretty easy question. You guys want me to take that? I probably had something to do with chocolate. Okay, here, you have that because I don't know this. Ooh. So I don't know if you guys want to talk about that. Great.
I'll just add,
Karen.
I will comment. I don't know if this is a full answer for you, but I'll just comment on an experience that I have in my local state. I'm from the state of Maryland, and about 2 years ago, we have a very visionary leader who started a group called the Maryland Environmental Health Network, and she's basing that on a couple other state examples. I want to say Rhode Island, a couple other northeastern states. And the idea is to bring together different disciplines and, in fact, groups that would be considered traditionally environment or ecology, but not so much on the health end or public health end of things, with public health officials within the city of Baltimore and the state of Maryland. So we're trying to make those connections and form those partnerships. Even 2 years in, it's still in the initial phases, but you've really identified the key problem there. So I hope we can all work on that.
Excellent. Any other questions for the panel?
Okay, I'm Liz Tennant. I'm also with the local hazardous waste management program in King County. And I just wondered if you could please discuss, one of the things that's a problem, I think, is we're beginning to get a good idea about, in a precautionary way, how we should stop certain behaviors. But the whole issue of alternatives, safe alternatives, and how we make better progress on that.
I think we talked about this a little bit, but does anyone want to take a stab at reiterating a little bit what we said about alternatives in the last Q&A?
I will say that with regard to safer chemical alternatives, that there are some, Elise mentioned green chemistry, but there's some very practical tools that are gaining traction and support that enable a manufacturer of a product who wants to create that product with safer alternatives to go through a sort of systematic analysis of the replacements, whether it's a replacement chemical or a replacement material or a replacement process to accomplish a goal, to come out the other end of a sort of an analysis and say, this looks safer for the following reasons. One that is now has been rather formally adopted by the Green Building Council is called the Green Screen, which was developed by Clean Production Action and some of their colleagues, which is a tool that one can use to systematically look at the properties of a chemical across a number of domains and come to some conclusion about how it rates. And then a manufacturer would have some assurance that that was a safer alternative. And it really creates some market incentive for progressive companies to begin to think in that way.
Excellent. A couple more questions. I also want to encourage you, these don't just have to be questions for the panel. You guys may have some excellent ideas down on your papers here. I see some writing, so there has to be something there that you want to stand out and say, this issue is important to me in my work, and here's what I want to do about it. And who has resources in this room that might be able to help me? We already heard from Eileen Gagne talking about an amazing resource that she has for the Master Home Environmentalist Program. So those are the types of, if we don't request, we cannot offer. I'm going to get to Heather, and then I think that's Elizabeth over there.
Hi, Heather Trim with FutureWise. And several times this morning has been brought up the issue of racism, other prejudice, and wealth. And I'm wondering what messaging has been successful to get that message across to people who don't want to hear it. if there's been, and I'm thinking Congress, but I'm also thinking of, just in general, if there's been some success in how to get that to be effectively heard.
Great question.
I think racism is so systemic and so institutionalized that most people aren't even aware of it. A lot of the deniers, they just don't understand how it manifests itself. I mean, we know that the more obvious ways, somebody following you in a store or something like that. But in terms of, how homes are financed and why certain neighborhoods are segregated and how the federal government and how agencies have helped to, and banking have helped to make that happen. People aren't as aware of that. And so, no, there isn't any messaging. And I mean, it's pretty clear in the attitudes against Obama that racism's pretty alive and well. And I don't think we have a message for it. I know President Clinton at one time talked about a national conversation about racism. That never really happened. And I think it's something that we probably all have to talk about in our own networks and our own localities. But I do know that, often we're all in we're all in our fields of study or work or activism. And, when we go to those rooms and we're talking about poverty or affected people or health disparities, and we see no person of color, is everybody speaking up and saying, where are the other people who need to be here? I mean, there's some small ways that we can all let people know it's not all right. It's not all right to have a room full of just white advocates about an issue that so totally affects all of us, or maybe even affects, very low-income folks. We've got to start speaking out about that and calling it out, and then we've got to start saying, Mary down the street, I think you should come to this meeting because we're going to be talking about an issue that you're involved in. And so there's small ways we can start, but there's no messaging around it because everyone denies that it exists.
There was a really interesting initiative here in King County that had to do with the food deserts and not having access to fresh fruits and vegetables at the local grocery store. And I remember they came before my council and gave testimony about, okay, how do we get the message out? How do we create an effort? Who do we need to talk to? And the way that was kind of flipped was around the obesity rates. When kids only have access to products that are unhealthy, that's all they're going to consume. That's what's available. So the message then became, how do we ensure that there is funding available to buy the refrigerator to keep that shop owner not being impacted negatively economically, so they'll get it at a discount or maybe for free. So they will have the availability for that refrigerator or that freezer or that case for fresh fruits and vegetables. So it's very much about identifying the need, but then looking for the right partner and ensuring that the message gets out to the community. Because even if you have fresh produce and vegetables available, will they buy them? Can they afford them? Do they know what's important?
I'd also like to just mention an initiative that was started by a friend of yours, actually, in New York City. Philanthropy has a big role to play in all of this because they don't really fund groups of color to do work in their own communities. They'd rather fund other groups to do work in that same community. So a woman named Kolu Zigby at the Jesse Smith Noyes Foundation realized that, food security was so important and obesity was happening all over communities of color and low income, but she never saw any people of color as advocates around those policies. So she got together with the Robert Wood Johnson Foundation and got some monies to get 10 groups of color nationally, to fund 10 groups to be involved in food policy. And we got one of those grants. It was $27,000 a year. But we were so grateful to be able to get access to have our voices heard and to understand and interact more in that policy arena around food. And so for the next 5 years or so, we were able to be very involved in food policy. But again, you know, it takes that leadership, it takes that person saying, this isn't making any sense. How do we create diversity of voice and perspective in an issue that's so important to certain communities? And, you know, how do we make that happen? And so again, it takes leadership.
Thank you so much. Go ahead. You've been waiting, very patient.
Actually, Margot, I just wanted a chocolate bar.
Oh, it works. It works.
I'm Elizabeth Loudon. I'm with ECOS, and we're a nonprofit environmental organization. We're based in South Park. And I wanted to mention a couple of resources we have. We're very proud to be couple-year partner with Eileen Gagne and the Lung Association on doing healthy home assessments and being able to provide those in different languages. We are not an advocacy organization, but we do environmental justice in terms of making programs available in many, many different languages. We currently have, I think, around 15 different languages spoken by our staff members. And I wanted to introduce Suporn Sim, who is project coordinator for indoor air quality program that we're doing. We have an EPA environmental justice grant, and we're doing outreach in Tukwila and SeaTac. It will be free. The emphasis is outreach with Somali, Bhutanese, and Burmese new immigrant arrivals, and being able to provide information like the green cleaning kits, and also home assessments. So we have a table if people want more information. We also do outreach to small businesses and on pollution prevention, and about 50% of the businesses we met with this year were minority or immigrant-owned or managed businesses. So, yeah, thank you.
Thank you, Elizabeth, for demonstrating such a great offer of services. And for that, I'm going to reward you with this very amazing book, Healthy Child, Healthy World. I think it might be good for your office. We appreciate that offer of help and support, and that's exactly what we need to sort of tap into the energy and the amazing experience that we have in this room to be of service to each other. So I don't see any last final questions, so I'm going to start transitioning us. Did you have a question, Bob? Comment? We like, of course.
Since I had the time, I was just looking up at the in terms of clean water issues that people have talked about on the World Health Organization website. It would cost, depending on the types of improvements for the entire world, it would cost anywhere from $10 billion to $130 billion a year to improve the entire world's water and sanitation supply, with the higher end being for apartments with advanced sewage systems and things like that. I'm just mentioning this because if you compare that with military budgets worldwide or other things, this is another example of misplaced priorities where for a relative fraction of that, we can guarantee this for the whole world. So I just wanted to mention that.
Thank you. Thank you for the immediate research. I love that. Okay, we have one last comment, question on that side of the room, and then we're going to transition. You guys see what I'm getting ready for, right? You've been good.
So in terms of race, there's a very interesting exhibit going on the Seattle Center right now about race. And I think it would be really beneficial for everybody to go through because we all have some disparities to work through.
It's at the Pacific Science
That's
Center.
right. Thank you.
At the
Yep.
There's an exhibit about race at the Pacific Science Center. Through January. Thank you so much for sharing that information with us. Really appreciate the panel's excellent conversation and responses to your question. Really, really insightful questions, and we'll be getting more of that conversation later in the afternoon.